close friend of my son died by suicide, and it helped me understand just how challenging that experience is for the whole community. But it also helped me understand how there are ways to help a community understand those challenges, identify people who are at risk, and get them to the treatment that can help prevent.
We've developed a specialty area in working with suicide. So suicide prevention and suicide postvention. What happens after there's been a death? How do we help the family? How do we help the community? How do we help the workplace? How do we help the school recover from that? Mental health professionals don't get good solid training on this in their graduate training, which is kind of wild. We would never see a cardiologist not getting good training on treating a heart attack, which is why we feel very proud of the fact and honored that we're doing that work. We're training mental health professionals in what's best practice right now.
Even prior to the pandemic, there was a significant need for workplace mental health programs. The outcome of not addressing mental health issues is that the struggles are going to show up in the workplace. And the way they show up is absenteeism, presenteeism, low morale, decreased productivity, less satisfaction with work, which leads to higher turnover. So for businesses, there's a human imperative and a financial imperative to address behavioral health.
I remember when my grandmother wouldn't say the word cancer. She would whisper it. She didn't want anyone to hear her say the word cancer. And I feel like for a long time, that's been how we've addressed mental health, substance misuse, substance use. We haven't talked about it. I think the conversation is changing. I think more and more organizations are demonstrating the courage needed to have these conversations.
We know we could be doing better for schools, for companies, for all of these different sectors that BHI is working in. And I think that we have the dexterity to respond in a way that many of these larger service systems don't, to adapt as we learn the new science, as we learn, what is working. And I think that that's really exciting.